This is Radio Health Journal. I'm Reed Pence. This week, fibbing to our doctors. Almost everybody does it for what we think are good reasons.
They did not want to be judged. They didn't want to hear how bad the behavior in question was for them. They were embarrassed.
But there's also a big downside. We'll find out about it when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Education has only ever had one thing in mind, at least from my viewpoint, from the ground level, and that's how can we take care of our students and make sure they learn.
The demands of teaching during an almost year-long pandemic. Then,
I found myself caring so much and getting so upset that I called my sister and I said, "What is happening to me?"
The emotional roller coaster of youth sports. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
Anytime you go to the doctor, whether via telemedicine or face-to-face, you can expect a few questions about your habits. Do you exercise? How's your diet? Do you smoke or drink alcohol? Are you taking your medications? Those questions are all normal. It's also apparently normal for us to fib when we answer them.
We did two separate studies with a combined total of about 4,500 people. And in one study, it was 61%, and in the other study, it was 81% that withheld at least one of these 7 types of information.
That's Dr. Andrea Germankin-Levy, Associate Professor of Psychology at Middlesex Community College in Middletown, Connecticut. She's first author of a pair of studies looking at how often people are less than truthful in response to their doctor's questions.
We didn't specifically ask about lying, first because we thought people would be less likely to admit to it if we used such a strong word, and second because we weren't just interested in commissions, we were interested in omissions. So even if they're kind of passively not offering information, but doing so deliberately, that seems important too. So we can't say that 61% and 81% of people lie. All we can say is that they're withholding these particular types of information, which of course has some overlap with explicitly lying.
So in other words, people are often stretching the truth. Maybe we say we exercise more than we really do, or drink less than we really do.
Most people reported withholding from their healthcare provider information such as having an unhealthy diet, not exercising, taking a certain medication, even taking someone else's prescription medication. And when we asked them why they did this, the reasons that came up the most were that they did not want to be judged, they didn't want to hear how bad the behavior in question was for them, and that they were embarrassed.
Most of them said they didn't want to be judged, or they didn't want to get lectured, those types of things. And there was also some other little interesting things. People were embarrassed by things, or they didn't want to be difficult, or they didn't want to waste the doctor's time. So you can understand why somebody might choose not to give or fully disclose everything.
That's Dr. Maricela Moffat, professor of medicine at the University of Arizona College of Medicine, Phoenix. She's also director of the doctoring curriculum, which, among other things, teaches medical students how to get patients to open up and share everything a doctor really needs to know. She says that the study of patients shows that some are more likely to withhold information than others. Women, younger people, and those in worse health are more likely to stretch the truth. Patients are also more likely to omit information if the doctor is young and male.
So you can imagine a young woman seeing a young male doc, not wanting him to know maybe that I engage in stuff that's probably, harmful to me, that I know is. Maybe that I'm smoking or drinking too much or maybe using drugs or whatever. It's just, you could see that angle there. I mean, that I don't want to be judged or I want you to think the best of me. And I think as human beings, I think that's really what we want. I mean, we all have masks. that we're projecting that everything is perfect. I mean, look at Facebook. So it's just, I think it is a little bit more pervasive now, even outside of medicine. So I could see why that is.
We know that people tend to withhold information from others, and we know that this is especially true when it comes to sensitive information, and a lot of what doctors and patients have to talk about can be pretty uncomfortable. So it can be hard to tell your doctor some things, especially because as patients, we want our doctors to like them, and we don't want to be embarrassed, and we don't want to feel judged.
Some patients may not want to admit things that could get them in trouble if their spouse found out. So if a patient really doesn't trust that their doctor is going to keep things confidential, the doctor may not find out that, for example, the patient's at a high risk of a sexually transmitted disease.
That is a reason that we asked about, and that did come up. We specifically asked about concerns about the information in question being in their medical record, which then, of course, has the potential to be shared with others. And some people did say that that was a factor, but that was not among the most common.
But doctors are not always blameless if their patients don't level with them. Moffitt says the fear they'll be judged or lectured is legitimate.
In my own life, as having been on the other side of the bed as a patient, yeah, I'm going to say this. Docs, in general, don't have great bedside manner. And I think maybe that's what inspired me to do what I'm doing, in that there's a better way to do this. If a doctor asks a leading question, for example, "You don't smoke, do you?" And you heard even the judgment in my voice when I said it. So it's how we ask the question. So a student would get dinged in my course if they ask any leading question. Or it could even be what we call a stacked question, where I may ask 3 questions in a row, and typically most patients aren't going to be able to hold the first one in their head, so they'll answer the last one. So it's not like they're even on purpose doing it. I think that we as physicians need to take some responsibility in this, is that we may ask leading questions, we may ask stacked questions, and so patients are going to respond in the way they think we want to hear it.
But obviously, that carries consequences. Germenkin Levy says when we fib to the doctor, it's not always a harmless little white lie. Maybe patients would be more forthcoming if they knew that.
It's so important for clinicians to get accurate information from their patients so that they can make accurate diagnoses and so that they can make appropriate recommendations. There's some real consequences that can arise when patients don't fully disclose medically relevant information or withhold medically relevant information. It can have very real consequences for patients' medical care and ultimately their health. So, for instance, if a patient neglects to mention or deliberately withhold information from a doctor that they're taking a certain medication, the doctor could then go and prescribe a medication that is dangerous in conjunction with that undisclosed medication. And there's so many possible scenarios like that one that can result from patient nondisclosure.
So what can we do about it? It wouldn't be so bad if doctors knew when their patients were fibbing. But Moffitt says there are only a few clues that studies have turned up. One big one?
You pause before you lie. There's this decision that you're making in your head. Am I going to get up to it, or am I going to just fib here? And I thought that was kind of interesting, because that's not something that I personally am really aware of. And in fact, I can tell you physicians are usually the worst person to figure out if the patient's lying.
I think we know from research on lying that it is in general difficult to detect lying, whether it's within the medical setting or not. I don't think that doctors get any specific training in that regard. And there's so many other things that doctors have to focus on that the patient does talk about that I'm not sure that they have a lot of time to kind of chase down things that the patient isn't talking about.
However, Moffitt says it's time very well spent. And even though it's patients who aren't forthcoming, doctors are the ones who are in the best position to take some time to fix it.
The docs, we need to take some responsibility here and create the environment that the patient feels comfortable opening up. Because I'm going to say this, even questions that are on a more intimate nature, like sexual behaviors, if I don't know you're engaging in these things and there are maybe risks to you that are associated with this, then I'm blind to that, and I'm not considering it in potentially the differential diagnosis that I may be considering in you. And if I don't have that information, shame on me. It's partly my fault. I would hope that my patients would be more forthcoming, but I'm going to say we got to own our piece of this. And I think that is creating that environment of trust so that you know that I'm not going to judge you. This is information that I need to help take care of you.
Is it a matter of having clinicians make better eye contact? Is it a matter of asking the more uncomfortable stuff kind of in a questionnaire prior to the appointment? Because maybe it's easier to tell a piece of paper about something embarrassing than to tell your clinician face-to-face. Maybe it's a matter of when the clinician asks about some embarrassing symptom or uncomfortable issue going on, that maybe if the clinician normalizes it for the patient. Hey, I have a lot of patients who deal with erectile dysfunction at your age. Do you ever feel any issues in that regard? So perhaps that would make patients feel more comfortable. We would have to kind of test these different strategies, but those are some possibilities that could potentially have an impact.
The doctoring curriculum Moffitt directs at the University of Arizona tackles all of this head-on by teaching medical students communication skills that invite the patient to open up.
How do you teach a young person to engender trust? And so those are the things that I work with my students on. So it's really active listening. So you shut your mouth and you allow your patient to tell the story. You can ask clarifying questions. I'm going to say this. It is truly is a labor of love because most of us want to get in and just get the story and make a diagnosis and then move on. But in truly trying to develop trust, you need to actually allow your patient to talk.
One key is to get patients to connect emotionally in the encounter.
It would go something like this. So tell me, emotionally, how are you dealing with this? And so you may say to me, I'm really worried about this chest pain. Okay, so then I'm going to ask an explore question. So tell me more why you're worried. And then you might tell me, oh, my gosh, my father died when he was my age from a heart attack, and I think this is what this is. Or you might tell me something else, okay? So the issue here is that now I have an understanding of why you're worried.
One other skill Moffitt teaches is silence. Sometimes doctors have to resist filling it up with their own words and let the patient do it.
It's amazing. I mean, we feel uncomfortable with it. And so it's just little techniques that you tell the student you need to count in your head, 1001, 1002, so that you allow, it's going to be uncomfortable for you. You're going to want to feel it, and you cannot. You need to let them. It is truly, silence is golden. It really is, because it will allow the person sitting across from you to open up and begin to share.
It's also important for doctors to make everything they say understandable, because one other finding of the survey on fibbing is this. Many patients aren't telling the truth when they say they understand what their doctors told them. But none of what it takes to get patients to open up and tell the truth takes very long as the doctor knows how to do it.
You can imagine, just like the tools that I am using, most docs feel like this takes too much time. It takes too much time. I have 15 minutes with you. Are you kidding me? There are rubs both ways in the sense that physicians see barriers in truly trying to apply many of the techniques. But I tell my students, if you emotion validate, it takes less than 30 seconds to do. And you have changed that encounter. You've changed that person because they're going to be more interested in giving you information. It's worth 30 seconds.
You can find out more about all of our guests through our website, radiohealthjournal.org. I'm Reed Pence. Coming up next week on Radio Health Journal.
People that are not practicing mask wearing are going to be at higher risk getting infected from this one than the other one, which is already infectious enough, right?
The new strain of COVID. Just how dangerous is it?
Then, food waste. How to keep those leftovers out of the trash.
To me, sometimes food waste and food safety live right next door to each other. If it smells bad, if it looks bad, if it's the wrong color, obviously those would be food safety concerns.
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.